Vitamin D deficiency is a common health issue that can lead to various health problems. Here's an overview of its causes, symptoms, risk factors, and treatments. Causes. 1. Inadequate sunlight exposure. Vitamin D is synthesized in the skin upon exposure to sunlight. Limited sun exposure can result in deficiency. 2. Dietary insufficiency. Diets low in vitamin D-rich foods like fatty fish, fortified dairy products, and egg yolks can contribute to deficiency. 3. Malabsorption. Conditions like celiac disease, Crohn's disease, and cystic fibrosis can interfere with the absorption of vitamin D from food. For kidney and liver disorders, these organs are essential for converting vitamin D into its active form. Disorders can impair this process. 5. Obesity. Vitamin D is fat-soluble and can be sequestered in fat tissue, reducing its availability in the bloodstream. 6. Age. Older adults have reduced capacity to produce vitamin D from sunlight. Symptoms: fatigue, bone pain, muscle weakness, or cramps. Mood changes such as depression. Severe deficiency can lead to osteomalacia, softening of bones in adults, and rickets, bone deformities in children. Risk factors: limited sun exposure, living in northern latitudes, wearing covering clothing, using sunscreen. Darker skin, more melanin reduces skin's ability to produce vitamin D. Older age, obesity. Certain medical conditions, for example, gastrointestinal diseases, kidney or liver disease. Breastfed infants not receiving vitamin D supplements. Diagnosis. Diagnosis typically involves a blood test to measure the level of 25-hydroxyvitamin D. Treatment: supplements. Oral vitamin D supplements are commonly used. The dosage depends on the severity of the deficiency. Diet: increasing intake of vitamin D-rich foods. Sunlight exposure. Moderate sun exposure can help boost vitamin D levels. Treatment of underlying conditions, addressing any medical conditions that may be causing malabsorption or other issues. Prevention: ensure adequate sun exposure while balancing skin cancer risk. Consume a balanced diet with sufficient vitamin D. Consider supplements, especially in high-risk groups such as the elderly or those with limited sun exposure. If you suspect you have a vitamin D deficiency, it's important to consult with a healthcare provider for proper evaluation and treatment.